I'm Carrie Defoe with the Northwest Georgia Regional Commission Area Agency on Aging, and I am here to share with you some of the services that are offered and referred to by the Area Agency on Aging. We have a referral database that contains over 20,000 statewide resources to help seniors, caregivers, and disabled individuals find and achieve the results that they want to help them age in place as long as they choose to do so. I'm the Medicare specialist for the Area Agency on Aging, and the first two programs that I'm going to talk about have specifically to do with Medicare. First is a low-income subsidy that is available for people who have Medicare Part D. What it does is it helps people defray the cost of their Medicare prescription drug premiums and their Medicare prescription drug copays. The maximum that you can make and get some level of assistance with your prescription drug coverage right now is about $1,296. And if you make about that much or a little bit less than that, I encourage you to give us a call so that we can screen you for the services that you might be eligible for. There is another level of service called the Medicare Savings Programs, and those are Medicaid programs that assist people who are very low income in defraying the cost of their Part B premium, which is $99.90 this year, and also helps them enroll in the low-income subsidy for Medicare Part D. The average savings to an individual who enrolls in either the low-income subsidy or the Medicare savings programs is about $4,000 a year, so that's $4,000 more in your pocket if you're deemed eligible for these programs. And the limits for these programs change every year, so I encourage you, if you've already tried and you've been denied, try again, because things change and you never know when it's going to change again. The next program that I want to talk about is funded through the Older Americans Act, which is up for renewal, by the way. So you need to be listening to what your congressmen and senators are saying about the Older Americans Act. The Older Americans Act funds things that are called home and community-based services. One of the community-based services is the Congregate Meal Program, and many seniors in Paulding County don't realize that if you're age 60 or older, you can come to the Senior Center on Industrial Drive North and you can sign up to have lunch Monday through Friday free of charge. There is no eligibility requirement for this service. You only have to be 60 or older, or you have to be disabled and receiving Medicare in order to be eligible for this service. There's no income limit, there's no screening. All you have to do is come in and visit with the site manager and tell her that you'd like to sign up for the Congregate Meal Program, and she'll hook you up. They do ask that you sign up for whichever days a week you're coming so that they know how many meals to order every day. Another of the home and community-based services is the Home Delivered Meal Program, which is generally about 3 times as many meals as they serve in the congregate sites. The Home Delivered Meal Program delivers a hot meal to those people that live close enough to the service area, or a shelf-stable or frozen meal to those people that live outside the delivery area that would assure safe delivery at proper temperature. I'll tell you, for some of the people that are getting the home delivered meals, that's the only human contact those people get on a regular basis. And I have been in senior centers many times when the volunteer or employee who was delivering the meals came in and said, "We need to send somebody to check on this person. I saw something that I'm uncomfortable with." Those things happen more than you might think. Now, here in Paulding County, we have a very large congregate site. They serve an average of about 50 to 55 meals every day. In most counties, when they're serving that number of meals, they would be home delivering 3 times that many meals. So you can figure in Paulding County, they're delivering about 160 to 170 home delivered meals every day. And again, this is the only contact those people get. Screening for these services is done through the Area Agency on Aging, and you can reach us by calling 866-552-4464 and ask for services in your area when you hear it on the menu. Another one of the home and community-based services is respite care. Respite care is intended to help caregivers who are trapped in a situation where they can't get out, can't get away, can't leave the one in their care for any time at all. Average respite care services for an individual is about 8 hours a month, but that's 2 4-hour days when you can go get your hair cut or go to the dentist or just sit in your bedroom and read for a few hours with somebody else taking care of your loved one. Just some me time, and there's no cost to you for this either. It's funded by the Older Americans Act. Again, these services are screened through the Area Agency on Aging. I'm afraid there's a waiting list for that one, but you can't get it if you don't get on the waiting list. Eventually the waiting list gets cleared. The last of the home and community-based services is called Homemaker Services, and what this does is this helps people that are starting to get a little bit frail, not able to keep up with their everyday chores. This will have somebody come into their home and help them maybe do a little cleaning, run a few errands, help them with their shopping, do things like that for them. Average on this is about 8 hours a month as well, but it's a nice little welcome assistance, a little boost for people that are having trouble getting things done on their own. Again, these are all screened through the Area Agency on Aging, and they're all funded through the Older Americans Act, so they're all free to you. The largest program that the Area Agency on Aging is screening for right now and providing services for is the Community Care Service Program. In order to access the Community Care Service Program, you must meet nursing home level of care requirements. In other words, you must be eligible for nursing home placement, but you don't want to go into a nursing home. The Community Care Service Program offers services to help people stay in their home. Eligibility for the Community Care Service Program is based on your Determination of Needs score. So although there is a waiting list, don't let that stop you, because if your score is higher than someone else on the waiting list, you take the spot above them. The whole waiting list is set up so that those people that need it the most access the services first. Community Care Service Program can provide you with nursing assistance, in-home care assistance, certified nursing assistance, everything that you need to maintain your safety and stability in your home environment. What happens is the screeners determine your eligibility for the program, and then the community care service nurse comes out and does an on-site assessment, and together you set up a care plan. And then your care plan is assigned to a care manager, and believe me, you get to be close personal friends with your care manager. It almost always happens because you're working so closely to make sure that you stay well and you stay happy. The Community Care Service Program has no age limit. The Community Care Service Program can delay nursing home placement for a very long time, and the reason that the Medicaid program funds these services is because it's much less expensive for us to provide services in your home than it is for us to pay nursing home Medicaid once you are actually in a nursing home. Another one of our programs that is seriously underutilized in Northwest Georgia is our Adult Day Health Program. You have mom or dad living with you because mom or dad can't be independent anymore, but you have to go to work every day and you're a little worried about leaving mom and dad alone all day long. Adult Day Health is a place where you can take mom or dad. It's a health model, so they are medical models. If there are medication management needs or any sort of therapy that needs to be administered during the day, the Adult Day Health Centers can take care of that. The closest center to Paulding County would have to be Rome. And it would be Mercy Senior Care. We have another Adult Day Health Center in Dalton, which is Ross Woods, and we have one in Blue Ridge. So if you know anybody that you think might be able to use these services, in some cases these services are funded by the Area Agency on Aging's money, and the average cost for these services on an annual basis runs upwards of $20,000. So that's the value of the services that you could be eligible for. Again, screen through the screeners at the Area Agency on Aging, 866-552-4464, and listen for services in your area. The other program, the last of the programs that I'm going to talk about today, is called the Money Follows the Person program. This program started back in 2006, and it was actually contracted out to private management companies in its startup, but now the Area Agency on Aging is administering Money Follows the Person. Money Follows the Person, it ties in with the requirement that anybody who is living in a nursing home has to have an assessment every quarter, and as part of that assessment and review of their care plan, they are required to ask that person, if you could go out and live independently in the community, would you want to? If that client answers yes, then we send an options counselor out to that nursing home, and an assessment is done to see whether or not that person would be eligible to access Money Follows the Person and move out into the community, or whether there are some other support options that might be available to that person other than Money Follows the Person. What's really great about Money Follows the Person is it will transition you from the nursing home to a private living facility. You can have your own apartment, and it will pay for everything you need to get yourself set up in your new place. Once they've found a place for you to live, Money Follows the Person will buy you all the stuff you need to live in that place. Money Follows the Person will pay the deposit on the apartment. It will pay the deposit on your utilities if one is required. It will help set you up with a telephone. It will help set you up with whatever community support services you need, whether it be CCSP or the home and community-based services, whatever it is that you need, Money Follows the Person will set you up with. It will buy you furniture. It will buy you dishes. It will buy you linens. You've lived in a nursing home. You don't have stuff anymore, and Money Follows the Person will help you get stuff so that you can live independently and be happy and age in place. And Money Follows the Person will actually follow you and stay with you and monitor your safety and your well-being for 1 year. And you also have access to the Long-Term Care Ombudsman during that year because you came out of a nursing home, and so their services are still available to you for that year. And then after that year is up, it is expected that you will be able to live on your own independently with the community support services that we've set up for you using your Social Security like you did before you went into the nursing home. That's a really exciting program, and we're having a lot of success with that program right now. We have 16 successful transfers into the community right now and 25 pending. So we're moving along with this program. Don't forget that all of these services are screened for by our information and referral specialists. If you're looking for a resource anywhere in Northwest Georgia or anywhere in Georgia, call 866-552-4464. Ask for services in your area, and the information and referral specialists will help you get to where you need to be. Again, I'm Carrie Defoe. I'm with the Northwest Georgia Regional Commission Area Agency on Aging. I hope I'll have more information to share with you sometime soon.